So good enough.
Well, let me.
Yeah, you live on the party all day. All day long. It's good to get.
You're the boss.
Yeah, I think, you know, I'm not.
So.
See you next week.
Yeah. I want to know. Yeah.
Yes, please.
So,
You've been living
I
it for 9
just-
years. That's true.
The driver stopped. Get that. Walked over to.
Shelby, how are you? Yep. We're just gonna rally the troops and then we'll get started here in just a minute.
Take it from you. I'll let you
You can just use my face to like that.
Is that kind of winner?
How are you?
Yeah. I use yours instead.
We did a lot with.
Good.
Okay, perfect. So you let me know when you're ready.
I'm good to go. Okay.
Yeah. All right. Everybody, yeah, you can walk up there. That is the. Yeah. Hold us all together.
Good afternoon, everybody. Thank you for being here. We're happy to talk with you today. My name is Adam Nielsen. I'm the CEO of Pediatric Home Service. For decades, the individuals in this room who worked together, families, healthcare professionals, providers, hospitals, associations, and insurers have worked together to help children with medical complexities live safely at home. We're here today because Medica has decided to implement a new coverage cap. This coverage cap limits essential home nursing care for medically complex children to roughly 10 days per year if they have medical assistance as a secondary insurance support. These are children who depend on continuous nursing care to live safely at home. These are children whose nurses are monitoring their every move for respiratory distress, cardiac issues, bowel obstruction, stroke, and other life-threatening events. These nurses also manage life-sustaining equipment that these children rely on every day, including ventilators, feeding pumps, and more. This imposition of a coverage cap is not a small policy adjustment. It's a dramatic reduction that substantially eliminates medically necessary care for children. It puts families in an impossible position. In short, it puts our pediatric population in risk. For more than 15 years, Minnesota lawmakers, healthcare professionals, families have worked together to remove barriers and increase access to appropriate levels of care. Together, we have created an ecosystem that helps medically complex children avoid unnecessary hospitalizations. The intent has been clear: where care can be safely provided at home, these children should be at home with their families. This interpretation reverses that progress. It reintroduces barriers to safe discharges, destabilizes care for families, and shifts children into a far more expensive setting. Not because of medical need, but because of coverage limits. We have asked both Medica and the Minnesota Department of Commerce for clarity and answers. Families have filed written complaints, providers have raised concerns. Yet frustratingly, we have not received any meaningful responses, and state agencies have declined to intervene. Today, you'll hear from families whose children are impacted. You'll hear from healthcare professionals who understand the medical realities. You will also hear from a legislator who, alongside many colleagues, has worked for years to ensure Minnesota prioritizes access to home-based care. This isn't about special treatment. It's about access to medically necessary care. It's about patient safety. It's about honoring longstanding policy commitments to Minnesota's most vulnerable children. Thank you for being here today. We look forward to hearing from several of our speakers, and I'll now turn it over to Brandon and importantly Emily to share about their sons, Chase.
Thank you everyone for being here. My name is Emily Walter, and I am here speaking on behalf of my 4-year-old son, Chase. Chase was born in 2021 with a rare craniofacial syndrome. At 5 days old, we were told he needed a tracheostomy, which is a life-saving breathing tube, in order to survive. For anyone who does not know what a tracheostomy is, it is a hole in your airway and a tube that remains in place so that you can breathe. Due to his diagnosis, Chase is also dependent on a feeding tube and is deaf with bilateral hearing loss. Because of these medical complexities, Chase cannot go to daycare and needs one-on-one 24-hour hospital-level care provided by either a skilled RN or a trained parent. Thankfully, due to the ability of our nursing agency to staff nurses in our home, we were able to bring Chase home after 7 weeks in the hospital. However, many children remain in the hospital for much longer due to barriers preventing them from going home. Chase has had a private plan through Medica since he was born. His physicians have prescribed him 84 hours of nursing coverage per week, and his diagnosis has not changed, nor his need for nursing. Thus far, thanks to our home care nurses and insurance coverage, both my husband and I have been able to continue working. Because of his medical complexities, Chase is far more vulnerable and susceptible to respiratory illness, and it can escalate quickly and land him in the hospital, as it did just this past February. When Chase is sick, he often requires 8 or 9 medications given around the clock 4 to 6 times per day and sometimes requires him to be on oxygen. But thanks to the home care nurses and interventions they can provide, we can treat many of his illnesses at home and avoid hospitalization. If Chase's nursing coverage is not covered by Medica, then our family and families like ours will have to make many tough decisions, including giving up services, therapies, and access to additional medical equipment and other things insurance does not cover, reduce our hours of nursing coverage in order to preserve precious waiver dollars for these services, or make a difficult decision to not be employed and stay home with our child in order to preserve nursing hours. Up to this point, Medica has been covering these nursing services prescribed by Chase's doctors. I'll now hand it off to my husband Brandon to walk you through what we've endured over the past year.
Good afternoon. For about a year, Medica has been threatening to deny Chase's home care nursing coverage through letters and phone calls, and just a few weeks ago, we received a formal denial letter for 2026. We repeatedly asked Medica for answers and did not receive them. We firmly believe Medica is in direct violation of Minnesota State Statute 62Q.545. The statute has been established for many years and has not changed. The statute is very clear. Home care nursing services must be covered under the commercial plan, in this case, Medica, for persons who are concurrently covered by both the commercial plan, Medica, and enrolled in medical assistance. Our son Chase is enrolled in a Minnesota fully insured individual commercial plan through Medica, and he also qualifies for and is enrolled in Minnesota medical assistance. He checks all of those boxes. We submitted a formal complaint to the Minnesota Department of Commerce in early September 2025. And even though we've been informed that our complaint has been escalated, Commerce has failed to intervene. We, as consumers in the state of Minnesota, rely on the Minnesota Department of Commerce to protect consumers and enforce established statutes. And up to this point, Commerce has done neither of those for our son. To this date, no one has been able to tell us how Medica is not violating that statute. Many families also rely on medical assistance waivers to help cover other essential supports that can make it possible for our children to live safely at home. If nursing care is pushed onto medical assistance funding, families are forced to use waiver dollars meant for other critical services like therapies, personal care, and community supports. This doesn't just hurt families, it shifts costs elsewhere in the healthcare system and increases long-term expense to the state. We're here today to give Medica another opportunity to comply with the Minnesota state statute, and we're giving the Minnesota Department of Commerce a similar opportunity to act on our escalated complaint and enforce the established statute now. We are prepared to contest Medica's policy to the highest possible platform, not only for Chase, but for similar individuals requiring critical service and for the taxpayers of Minnesota. We are speaking out because our children cannot advocate for themselves. Please protect our medically complex children. Thank you. I'll pass it back to Kaylee for a few minutes.
Hello, thank you for being here today, for providing us this opportunity to speak and advocate for our children. My son will be 9 in February. His name is Mace. Mace was born with a very rare genetic mutation in a gene called the FOX2B gene. This genetic mutation not only affected the nerve cells in most of his bowel, so my son cannot survive and thrive through simply eating. He would starve to death because his gut is so short. My son is dependent on IV nutrition, and we depend on our home care nurses to help ensure that central IV line, which is a permanent IV, remains clear of infection, and that he remains safe and that he can grow and thrive. And that genetic mutation also caused a lack of nerve cells in his brain that regulates breathing. So every time my son falls asleep, he dies. He dies in his sleep. He is dependent on a ventilator to stay alive. And Minnesota law is that a child on a ventilator must have awake care. So we do rely on nurses to be awake overnight in our home every night to ensure that my child does not die while he sleeps. If these home care hours were cut, that would leave myself as a single mom to somehow work the current 6 part-time jobs that I work to ensure I can be home for both my children. But I would also now be left to somehow stay awake essentially around the clock to ensure my child doesn't die. Or worse, a lot of these children will end up being forced to live in the hospital. And I can tell you firsthand how difficult that is on families, how difficult it is for siblings, the financial burden of trying to feed yourself while you're down there and keep your mental health intact. And it's a big deal what this company is doing. We need to hold these big corporations accountable. It is unrealistic and they are misunderstanding the burden that they are placing on our state and on our tax dollars. So thank you for this time and please help us advocate for our children.
Okay, sorry, it's Dr. Kurczyk. Yeah, I'm so sorry. Dr. Kurczyk?
I'm not sure I can expand too much on your comments. They're both accurate and moving. I'm happy to be here. I'm happy you all are here. It's by coincidence that last week I attended a high school play, A Christmas Carol. And Scrooge was a senior who at age 2 was discharged with a tracheostomy and a ventilator. His performance, it was flawless. But the question today is, what would have happened to that toddler, now young man, had he not had the opportunity to have had continuous skilled nursing to support him during his ventilatory requirements through early childhood? What would have happened to that boy? For certain, he would have been in the hospital for at least 5 to 6 more months. Other children, it's more than 2 years. And being in the hospital, yeah, it costs more, but a lot of the costs are not financial. For sure, his parents would have struggled. Trying to be down at the hospital every day, dual working parents, well, there are heroes in our society. But we don't have to breed them by not supporting them. If he had been in the hospital, he might have been one of those few kids who acquired a hospital infection. As hard and as good as our children's hospitals work and are, they are a scourge. Hospital-acquired pneumonias, hospital-acquired diarrhea, hospital-acquired skin breakdown. These things are realities. And some might say, well, it could happen in the home. We'll get to that. The other thing that happens in the hospital are medication errors, safety events. And again, I have great confidence in our children's hospital. But the longer you're there, the more likely you're going to experience something untoward. So why doesn't it happen at home? It's simple. The parents are at home. The parents are continually at home. And they don't do the care. They conduct the care. They direct what cares are done. They sort out the nuances that support their child. There's none of the rotating providers that occurs in the hospital. Yes, we may have a new nurse every 12 hours. But we have continuous oversight by parents, which fashions an excellence of care that just can't be duplicated in the hospital. The second question is, what would have happened to these parents had they not had continuous, skilled home care nursing? What would have happened to them? It's the source of dark humor, and you'll have to excuse me. That periodically, parents would say, I'm not waiting for nursing. We're taking our kid home, trach and ventilator. And I would look at one of the nurses and we would smile behind their back and we would say, maybe 2 weeks. We'll give them 2 weeks. And we would give them the requisite skills to resuscitate and call 911. That's not skilled nursing support. That's parent training. Resuscitate, call 911. Well, now you're back where you started. So invariably, when parents try to do this on their own, it's impossible. It's a safety, not issue. It's a continual safety crisis from the point of view of a physician. One of these parents would have had to drop their career or their career trajectory. And it's usually the person who doesn't have the best insurance. So there ain't a choice there. The parent who has the better insurance, they go to work. Would they have chosen to have had a second child after the difficulties they had with this first, if we had added on to that the problem of not having that child home? When issues of resentment emerge, guilt emerge, anger emerge, these are very real phenomena in people who are being stressed. I would simply say that there are a lot of things we can point to in healthcare that don't work. This works. This works really well. We ought not to put this on the list of broken healthcare problems that we all face in our families. Thank you for what you do. You know, parents that go through this, what I have learned is they create a ripple in their community. People point to that because they are inspired, they are admired, and we are all elevated by what you are able to accomplish for your children. And so, thank you for that. Let's continue doing what we have been doing successfully for over a decade now. Thank you.
Hi, my name is Representative Erin Cagle. I represent Ridley, Hilltop, Columbia Heights, and Spring Lake Park. And when I hear your guys' stories, you know, it really brings me back to the care that my late niece got while she was still alive. She was one of these complex medical cases. And as Minnesotans, we care about our kids. Our Minnesota values call for us to take care of these children. And for more than 15 years, Minnesotans have worked across party lines to ensure that children with complex medical needs, like my niece and like their children, can get the care they can receive care safely at home rather than being unnecessarily brought to the hospital. It's a process getting those kids to the hospital, and it's not easy. And they're usually not there for a few hours in an ER. These policies that we've worked at remove barriers to hospital discharge, support families, and reduce resiliency on costly inpatient care. And the legislature's intent has always been clear. Medically necessary care should be determined by a physician and the care professionals and not by insurance companies limiting mandated care to save money. These families are paying their premiums, but are not getting the care that they are expecting. These policy shifts shifts care away from the home, but they don't reduce spending. They move the cost to more expensive and increase pressure on hospitals. These private insurance companies are pushing the cost onto taxpayers. We're not advocating for a new benefit mandate. Minnesota already has necessary coverage. You already mandated the necessary coverage years ago with legislation prioritizing access to home-based care for medically complex children. Today, we are concerned that those laws are no longer being obeyed, putting care of children at risk. We are calling for transparency, accountability, and immediate correction to ensure Minnesota's longstanding policies commitments are upheld. Private insurance seems unwilling or unable to provide all Minnesotans with affordable quality care. This is a symptom of the overall problem of private entities providing government services without any accountability to taxpayers. We have broken healthcare promises. We need to stop dividing people. We need to stop dividing them on income, on race, on religion, on sexuality, and whether you are healthy or not. We need to stop dividing insurance risk pools. We need a one risk pool so that we can share the cost for everyone. We need to stop the legal skimming of insurance companies off of taxpayers. We need to get the middleman out and go. We need to provide services directly to providers so that we are able to get the care that we need to the children that need it. And it's not just the children that are affected by this. My cousin also is affected by this, although he's not as complex as a lot of your kids. You know, his home services are being cut, life skills are being cut. And so we're gonna have a lot of people out there that are gonna need our help. And to me, it just seems like the private companies, the private industry is not willing or unable to provide the care that we all expect. And so I want to thank you families for coming here today and raising the issue, because I know how much it takes just to get somebody to come into your house and look after your kiddo while you're here. So I know it took a lot of energy to get here, and sharing your story is not easy, but we're here to fight for you guys. So thank you.
Good afternoon. My name is Kathy Messerling, and I'm the Executive Director for the Minnesota Home Care Association. Home care is a cornerstone in Minnesota's healthcare system. Simply put, weakening it harms everyone. Home-based care is a critical component of our system, particularly for children with complex medical needs. As Adam noted, for years, for decades, the policymakers have been working on this, and coverage for policies that restrict access to medically necessary home care undermines all of those years of work. You've heard a little bit this morning about what happens when they cannot access home care nursing. They most often remain in the hospital, as was noted. Hospitals then face discharge delays, increased patient utilization. It puts an additional strain on our hospitals across the state of Minnesota. Remaining in the hospital ultimately drives their healthcare costs up. Another option they can consider is doing away with their commercial insurance and going fully on Medicaid, which will then drive up the cost of the state program. Minnesota's healthcare system works best when care is delivered in the most appropriate setting, and we remain focused on cost effectiveness. A strong home care program supports families, stabilizes the workforce so they can continue working, as we've heard, and reduces unnecessary spending. The Minnesota Home Care Association believes that protecting access to home care is essential to patient safety, system efficiency, and responsible use of public dollars. Thank you so much for being here.
Good afternoon. My name is Nicolene Meyer, and I'm the CEO at Accurate Home Care. But more than that, I'm a registered nurse, and I began my nursing career nearly 20 years ago caring for children like Chase and Mace. It's both an honor and a privilege to help children receive care at home so they can stay at home. Home care works. The threat to coverage of home care puts children and families at risk. When nurses provide care for these medically complex children at home, it not only ensures that they stay with their families, but that we can continuously monitor, provide rapid interventions, and coordinate care with physicians to avoid unnecessary hospitalizations. It's crucial that this care is consistent because when nursing hours are cut, families are left without the support they need to keep these children stable. Home care nurses are there when it matters, to prevent crises and to respond appropriately to acute changes in condition. Minnesota has spent years building systems that allow children with complex needs to thrive at home. Arbitrary coverage caps that ignore medical necessity make safe home care impossible. Without adequate home care nursing, children like Chase and Mace remain hospitalized longer or cycle back through emergency departments. Those prolonged hospitalizations are disruptive to families and introduce additional threats to these already vulnerable children by keeping them in a setting intended to heal the sick, not provide ongoing care. When policies like this block access to home care, they reverse hard-won progress in Minnesota and harm the same families the system is designed to serve. Children belong at home. And when the right supports are in place, home is where they are safest, most supported, and best served. Thank you.
Everybody, my name is Peter Wheeler. I'm the president and owner of Pediatech Nursing, which is a Minnesota-based pediatric home care agency delivering the complex extended hour home care services that we're talking about today. So the population, I think they've been pretty well defined, but I think maybe for a second we should just take stock of who is in this room. The Walters, Kaylee, a single mother working 6 full-time jobs and caring for her son Mace. Dr. Berkowitz is here from the American Academy of Pediatrics in support of this care. Drs. Wheeler, Dr. Kurchek, the physicians who quite literally pioneered this care, are here in support. Agencies, competitors, right? Aligned interests are here. So I think that the volume of concern should be recognized, and it's broad and a diverse group. So I'm going to break from my normal remarks. I'll try to keep it under 3 minutes, Ken. So the population, right? Medically fragile children who need continuous skilled nursing at home. For Pediatech, that's all we do. So it's our singleness of purpose. And, helping families keep a critically child alive safely at home is, it's work that's very important, and it is intense, and it's narrow, and it's focused. And make no mistake, it is indispensable. It is the bargain alternative, right? So it's a bargain alternative to prolong NICU-PICU life. So not having adequate funding for this care is not really an option. And this what's happening today, what we're addressing is a threat to that. So Dr. Kurchak, hard act to follow, right? But he mentioned something that I think is very important, and that is the parents, right? And what's it like to be one of them for even a day? And what does home look like for them? Home for them is not necessarily what it's like for us, a place of safety and relaxation. In many cases, it is quite literally a miniature intensive care unit. ventilators, trachs, suction, feeding pumps, alarms, oxygen, enormous meds, emergency meds, and what home should never be, full of risk. There is risk. And, the parents, who are doing something every minute of every day that, I submit to you, many of us could not do for a week. They live with a level of vigilance that doesn't really turn off, kind of in a heightened state. And, the agency has a success and hires a new nurse who can cover the shift that's been open at their house. They go to work and they're thinking, is it as the representative? She's had 2 shifts of orientation. Is she truly competent? Because at the end of the day, as Steve said, they are the conductors of this orchestra, and they are their children's best advocates. And so they are always kind of thinking from that perspective. And so, right, never leaves their mind. They wake up to alarms. When the staffing breaks, which happens all too often, they cover the shifts, right? Even if it's overnight and they have to work the next day. They carry a silent guilt that nobody ever really talks about. But when something feels off and they can't be sure what it means, some parents I've talked to have talked about, the feeling the guilt, even though it's misplaced. But of course, any of us as parents would feel it. Or when they discover that something is wrong and that the child has been in pain for a couple of days. There's a guilt associated, I should have known it sooner, even though there's no way that they could have. But this is what their lives are like normally when things are going well, right? So imagine that's your norm. That's when things are going well. Life is hard. So let's layer on top of that the ground disappearing beneath your feet, right? As you're in that situation, which is analogous to what is happening here. As Brandon quite rightly cited and named, Minnesota has a clear law, 62Q545. And I'd like to say something about this law. It is short, and the intent is clear to any honest person who reads it. As Brandon explained, when a child is enrolled in a commercial plan, right? Commercial plan. So all the medical plans at issue here today. And concurrently, so at the same time, as a separate enrollment in an MA, a trigger condition is met. The MA triggers the law, the obligation of coverage for the commercial plan. Not for 10 minutes or 240 hours, which is what these families have been returned, and functionally useless for HCN, but for the whole time the condition is true, which is what any honest reading of the law would conclude. And that's why every legal analysis that I have seen going back to enactment has made that conclusion. All insurers, providers have commonly understood and applied the law the same way, covering this care without subjective cap or limitation since enactment until now. And what has changed? The law has not changed. I submitted to a top firm the very specific question: is there any change I need to know about that makes this legitimate? Their answer, look, our headline to you is no material changes. Triggers haven't changed. The plans that are obligated to cover haven't changed. So the only thing that has changed is the thinking within Medica's legal department. And I submit to you that is not enough to move forward with cutting the care. So, I would encourage you to look it up for yourself and decide for yourself. What do you think it means? I think you'll find that it's pretty straightforward. Now, if we were to accept that this new interpretation is correct, what would that mean? That would mean that every legal group, every insurer, every provider, folks at DHS that we've spoken with, everyone collectively misread the same short statute and then misapplied it for 10 or 15 years, since enactment, for all of time, uniformly across all carriers. But they were all incorrect. Really, so the insurers were then also paying for, let's call it 15 years, for a benefit that they never had to pay for. We would also accept that the legislators who were clearly intending, we can see their intent, to solve a problem by passing this mandate, actually passed a law that did nothing. It did nothing at all. They passed a loophole that was just waiting for a clever relabel, a kind of a semantic trick to bypass it. It's unfortunate, right? Because there are some lines, there are some things in public life that we can disagree about, but we shouldn't disagree about this. Medically fragile children deserve to be safe at home. And the law that protects them, as I say, which has been consistently applied and has protected their care since enactment till this moment. It should mean something in real life and not just on the paper. And then when we try to apply it, there's issues. I would submit to you that there are many different groups who speak and talk about and represent, quote, the most vulnerable people in society. And I would say that these children are actually that group, and they deserve our support. Yeah. Okay, I'll wrap it up.
Thank you.
So let me I'll be clear. This isn't really a technical policy dispute. It's life support. It's a difference between a trained nurse watching a ventilator at 2 a.m. and a parent alone with alarms, suction, seizures, and no backup. I think that Medica should examine their conscience and re-examine the statute and reverse course willingly. And I think that state regulators should also re-examine the law and enforce the law as it is written and intended. Thank you.
Hello, everyone. My name is Cameo Zender, and I'm the Chief Advocacy Officer with Pediatric Home Service. You have heard about the impact on families, and you have learned of the significant and untenable costs that would transfer to the state of Minnesota should a limitation on home care nursing services be permitted. I would also like to take a moment to highlight the amazing home care nurses that provide ICU level care to children with medical complexities. These nurses often make a difficult personal choice. They choose to accept a lower wage to follow their calling, to provide care to these beautiful children and to support families being together. Home care agencies and commercial health plans have historically worked together to establish payment rates that allow us to minimize the compensation gap between hospital-based nursing employment and home-based nursing employment. We have come to that with a mutual understanding that just a small incremental investment in home care has an exponential return on investment for everyone, including the health plans, who get the benefit of reduced hospitalizations and improved outcomes. For those of you who may not be as familiar with this portion of the healthcare system, we are able to provide the same level of care, provide the same level of outcomes in the home with qualified nursing at 10% of the cost of hospitalization. When reimbursement is reduced through benefit caps or otherwise, without regard to medical necessity or required nursing skill, Agencies are forced into impossible choices that destabilize a fragile workforce. Without nurses, children waiting in the hospital will continue to wait. Children currently at home will experience less consistent and reliable nursing staff. I can't say strongly enough, and you certainly have heard it from my colleagues today. This will place a strain in an already fragile system for hospitals, for the state Medicaid program, and most importantly, for families and their children. We are both proud and humbled to stand beside these families today who represent so many more. We understand that most are not familiar with this intricate and fragile system, but it's a lifeline for families with medically complex children. We thank you for listening and learning, and we hope you will help us to seek the urgent state intervention to protect coverage for critical home care nursing services by enforcing that same state law that has been consistently practiced since 2010. Thank you so much for your attendance today. Yes, and we will now open it up for questions from our audience.
How many people are you talking about? How many families like these today in the state of Minnesota who are directly affected?
Yes, so we estimate there are well over 2,000 families that require home care nursing services in the state of Minnesota.
Specifically for pediatric?
I can speak for pediatrics, okay. Yes.
And then, and I don't know if the parents are still able to chat, but I just would be interested in hearing more about who Chase and Mace are as children, like what their personalities are.
You guys like to go back up?
If you don't mind, yeah.
Sure. Yeah, Chase is an amazing little boy. Cognitively, he's smarter than any other 4-year-old I know. Loves outer space, loves numbers, loves being outside. And he's able to do that because we have nurses to care for him, and he can thrive that way. Loves music. Yeah.
Similar, my son is a very active little boy. He's got a lot of medical accessories. He's got a trach, a central line, an ostomy bag, and a G-tube. So our joke is that he doesn't have a lot of real estate remaining on his torso. He likes to skateboard, dirt bike, four-wheel. He's your average little boy. Cognitively, he's, quote unquote normal. Nobody would ever know he's as complex as he is without noting his physical accessories. And my son is complex enough that he cannot attend school without an RN. So if my son's RN daytime nurse's hours were cut, he would no longer even be able to attend school.
Same for Chase.
Yeah.
Chase has to have a nurse with him at school, so parents can't go with him, and if his trach ever came out at school, the nurse needs to be there to intervene, but we want him to go to school like any other kid.
Yeah. That social piece is really important for these children. Some of them aren't able, because their immune systems are so compromised, they're not able to leave the home. In cases like our children, where they are able to, it's incredibly important for their mental health and their physical health. These children thrive when they are allowed to thrive, and they're not put under a thumb. So, and with my son being at school, she mentioned, the safety risks. With my son having a central line, children don't always understand these things. It's difficult for parents and adults to understand these things. And my son has had instances where other small children have accidentally attempted to pull his central line. So if that would have been successful, my son would have bled out before an ambulance could have arrived. So it's extremely important that these kids be allowed to stay in the community, stay at home where they can thrive and be loved. Love is what heals. When these kids aren't at home in their environment, they don't have that love around them and that healing environment. And that is what actually helps these children heal and be able to spread their light out into the world and show people what God is made of and what a miracle really is. So.
What have you specifically heard from Medica? Just rejection letters, or what has been their response? to your?
Myself personally, a lot of silence is what I've heard. Letters, rejection letters, essentially. I've not really heard beyond that. How about yourself?
No, we've got a lot of recorded phone calls with Medica trying to get answers, and they either don't know or can't explain it.
Or you
And
get stuck in a phone loop.
yep. So they've denied coverage for him for the full year. They've capped it at, as someone mentioned before, about, well,
I think it's 240 hours.
what they're trying to also do in these letters is reclassify it as home health services. Say you need to be given a medication or have your vitals checked and have a nurse come in and just assess you. That's not what these kids need. They need continuous care, and it's not just a 2-hour visit to perform a medical treatment. It's continual care to make sure that they are stable and able to be home. But Medica is trying to reclassify that or twist the words around so that it's not interpreted that way. And that's in the letters that they've sent. They call it home health visits, and that's not what this is. This is skilled complex nursing care.
The continual monitoring is really the key.
I don't mean to keep asking, but if no one, I had just, when were you first alerted to the change? In what month? Do you remember the specific
Within this
time?
time last year, they tried to do this, and enough of us stood up to them and said, we will not accept this, and they did concede, but now we're right back to the same tricks. So they're just trying to see what they can get away with, essentially.
So depending on the outcome of all of this advocacy and, raising this issue, what will you do come New Year? What is Plan Z at this point, just suspect?
Well, as of right now, my understanding is that there is only one remaining compliant insurance policy in the entire state. And if unfortunately we let Medica get away with this, they will probably follow suit. And a lot of these children's home lives will be at risk, their safety will be at risk, and their mental health will be at risk. As I previously stated, a lot of these children will be forced to live in the hospital. For myself, that 240-hour cap, my son would meet that in less than 2 weeks. So 2 weeks out of an entire year is what his life is worth to Medica at this point. I wouldn't be able to safely keep him at home. He would be forced to be hospitalized, which is totally unfair to him. Yeah, same. And I would like to note too that part of the Medica plan, part of the direct care consumer services is a program called Paid Parent. So a lot of us parents are essentially unemployable because especially during the winter when you've got respiratory infections going around and bad road conditions, your staff calls in a lot, which means you're calling in a lot, or your child requires so much care that you can't work a 9 to 5. So there's a program in place that allows parents like myself to receive paid hours when you are covering. But MA has a policy in place that says if you choose to receive that income to help you keep your child at home and pay your bills, then MA will not pay your home care hours. So if the private sector now disappears, we are forced to go 100% MA and lose our income. So now if you're like myself, where you rely on that income, I'm forced to seek income outside the home, which means I'm no longer present to care for my child. So it's a big deal.
I don't know if you two can answer this, but you said that there's that Medica had this year.
Yeah.
Is
one
there
remaining that is compliant.
One remaining. So has anybody heard if they are aware of what Medica is doing right now, or they're waiting to see if Medica?
I'm not sure. I'm not sure. We've had Medica for 9 years, so yeah, I'm not sure. This is the first I've had to deal with that other company. Good question.
We talked about the hours. What does that amount to in terms of actual dollar figure to, and then I'm not sure if that is a statistic that is readily available, but what are we looking at for that? And then, yeah.
I can try to answer that question. As has been stated, the information that families are receiving is that there will be a cap on services that are covered equal to 120 visits which equates to 240 hours, the way a visit is defined. Speaking for the children that we care and the average number of hours they require, that is only 1% of the hours that they would require or that are physician directed for that child to receive throughout the year. To try to translate that into dollars is a little bit more challenging, right? So the state of Minnesota, because we're not only talking about the hours for nursing care, we're talking about the likelihood of the entirety of that child's medical cost being transferred to medical assistance. As these families have stated, many of them seek commercial coverage for that access to home care nursing services. So that either as a fiscally responsible individual and or to preserve waiver dollars for services that have no other home, right? Have no other source of coverage. But if coverage for home care nursing services is no longer a viable or reliable benefit through that commercial coverage, there no longer is that incentive for families to seek that additional coverage. So that means, again, the entire transfer of that medical cost to the state of Minnesota.
And if they were to go out of pocket, what would be a week of this specialized nursing care?
Oh gosh, I am so far from a mathematician.
Yeah.
So even if we were to take the state Medicaid rate, which I think is at about $60 per hour. Someone do the math for me. $60 per hour. If we were to say 18 hours per day, I see lots of people running. Fantastic.
I can personally say my son's home care hour bill is roughly around $60,000 a month.
A month.
Per month.
The reason that.
And that ebbs and flows, of course, but.
The reason that every family has Medicaid backup is because in the hospital, that's what they're told right away, because gaps in coverage could be financially devastating, right? Yeah. So oh, sure. So the answer is that even, it accrues very quickly. And also directly related to your question, the 240-hour token benefit. Let's not forget that even with a functional mandate, normal cost sharing is part of the deal. That's healthcare speak for deductibles and co-insurance. A lot of these plans have, $6,000 or $7,000 deductibles, which get billed to MA. And so, a lot of this token benefit is already shifting to MA, and I would say that the actual amount that's left that the insurer would pay would be small. So I think it's a fact worth recognizing.
I have another question. I'm a provider, 29 years, pediatric home care services, committed to that. I am asking the families, what has evolved with your relationship with your commercial insurance? I know years past, you used to have like a case manager to discuss any issues, and they check in and see how you're doing, seeing how the kiddos are doing. What does that look like today? How has that evolved or de-evolved?
Yeah, Medica does still offer case management. I do get phone calls, but I am controlling in the best of ways because, as somebody previously stated, we as the parent essentially are the care coordinator for our children, and no one knows them as well as we do. So I never received those services from Medica, but they do still offer those services.
I just want to make a comment, if I may. It has come up that periodically a parent is called upon to take a shift. I don't want anyone to leave here for 1 second thinking that a parent is a nurse. They are educated with very specific tasks, and they know how to recognize impending doom. They don't have the breadth of nursing knowledge. They don't have the breadth of critical thinking, but they are willing to shoulder the risk for a brief period because they have been trained to recognize decompensation, resuscitate, and dial 911. Now, those of you who are parents that don't have a complex child, if your sense of anxiety has not just gone up a little bit, it ought to have. there are significant burdens in taking on a shift. It's not for the frail.
Well, once again, thank you, everyone who has attended, and especially to the families who have taken time out of their days to come and share their stories. We believe there is a very clear statute in place, and our ask is for the state to intervene at least until the legislature, and you heard from Representative Cagle, has an opportunity to act and to clarify the clear intent that has been in place since 2010. Thank you again so very much.
Because